Hi, I'm Dr. Lillywhite from San Juan Veterinary Hospital. We today want to talk about toxoplasmosis. It's one of the zoonotic diseases that is transmissible between people and animals. It's an organism called Toxoplasmosis gondii that causes this disease. It's an intracellular protozoal organism. It can be transmitted by a number of different methods. One method is by congenital transmission. It can be transmitted also as an animal or a person eats undercooked or raw meat or tissues. Cats are very prone to eat raw or undercooked tissues as they chase mice or rodents. They eat these tissues. If the rodent has been infected, then they become infected also. They pass the oocysts out in the stools during that period in which they are infected. It's a short period of time. It's only for a couple of weeks that they are infected, and that's for their life. Once they overcome the disease, then they generally are expected to have immunity for the rest of their life. So it's only a very short period that any one cat would transmit the disease. After the stools of the cat have been passed for 24 hours, they become infective and can pass the disease to other animals or to people. It can be transmitted then by accidental hand-to-mouth contamination. Children and cats love litter boxes, but they are in love with litter boxes for different reasons. Cats think that they are wonderful litter boxes, and the sandboxes thus become a source of infection for the children who play in the box, and then they are prone to put their hands in their mouths, causing an infection to begin in the children. This can be very serious in children. They can develop ocular damage that can result in eye damage or blindness in them. It's important to try to avoid this, and we'll talk in a few minutes about how to avoid contamination. The infection that most of us get when we have toxoplasmosis is quite insignificant. Undoubtedly, I have had toxoplasmosis at some time in my life, as many cats as I've handled. However, I never knew that I had the infection because the symptoms were so minor, probably just a headache or maybe a fever that accompanied it for a day or two, and then it cleared up. About 30 to 40% of the cats and 30 to 40% of the people that have been surveyed have had toxoplasmosis. This has been determined by serology, as we have determined that antibodies have been built up to this disease, though almost none of these people ever knew that they had the disease. Again, with children, it can be a serious problem. Also with pregnant women, it is a very serious problem, as the fetus can be infected in the uterus. This can result in serious ocular damage, which can result in blindness for the child throughout its entire life, or stillbirth occurring. Fortunately, we don't have to avoid cats to avoid toxoplasmosis. There are things that we can do to avoid the infection in ourselves, in our families, and to help minimize the infections in our pets. One of the things we need to do is to make sure that we avoid eating undercooked meat or tissues. This isn't too much of a problem for us, but in cats it's a real problem. They tend not to cook the mice that they catch. We know that they eat infected mice, and that's how they become infected, and then they pass the oocysts out in the feces. Those oocysts again become infected after a period of 24 to 48 hours. So if we clean the litter box every day, then we don't give the organism a chance to become infected, and thus we can prevent the disease. Also, it is very important that women who are pregnant avoid cleaning the litter boxes unless they are wearing gloves. And the last recommendation would be, with sandboxes, keep them covered unless the children are playing in them. That will prevent the contamination by the cats who find them an attractive litter box. We love our pets. We hope that you will be able to keep your pet healthy and strong and avoid transmission of diseases such as toxoplasmosis to you and your family. It's a wonderful relationship we have. They enhance our lives, we enhance theirs, and life is good as long as we take these precautions. Thank you very much.